Right. Well, we hope you had a restful break and are ready to jump into our 5th session of the Board of Directors workshops, which is the Board of Directors self-assessment. Let's take a look at today's agenda. So we do have just a couple of housekeeping things, introduction of our presenter and our presentation, and then we'll end with a Q&A session following another 10-minute break. And we will end promptly at 4 p.m. So before we get started with this session, here are just a few instructions for interactive participation during the session. To ask a question, again, we select chat at the bottom of your Zoom screen, and then you type your question or comment into the chat box that will appear on the top right of your screen. And to react again, you can click reactions and then use the heart emoji. And we do encourage that you turn on your cameras so we can definitely see all your lovely faces as we go through this presentation. And now we would like to introduce our next presenter, Evey Maho.
Good afternoon, everyone. I am Evey Maho. Evelina is fine, or Evey for short. I am from the Coyote Pass people clan, and I'm born for Zuni Edgewater. My maternal grandfather's clan come from the Rock Gap clan, and my paternal grandfathers are from the Towering House clan. And I come from a very small, remote area east of a small town called Tuba City, and it's in northern Arizona. In this remote place in Navajo, it's called Diné, meaning the people's water. That is where my, no problem, Divya. That is where my maternal grandmother's, the lineage come from. And that's who I am. And welcome. Next slide, please. So today we're going to learn about board assessment and its value. And we're going to also kind of go over some key elements of an assessment process and a tool we'll also be sharing with you today. So first off, we wanted to do a polling question, and just to get an idea if our current board members who are attending this session have ever conducted or participated in a board self-assessment. So we'll take a few seconds for you all to answer that. There should be a polling question on your screen. So if you could just indicate whether you've had that done or not, that would be great. So thank you for your participation. Our results show that 43% of us attending this session has participated in some form of a board self-assessment process. And then we have at 29%, and then we have another 29% who have indicated that they're not quite sure. So for those that have participated already, I'm sure we'll add a little bit to your processes that you've attended where you've done board assessments. For those of you who have never participated, we hope to bring some ideas and thoughts to your team to begin to infuse that as well. And I also invite for those who've done board evaluations before to also kind of share some insights on your experience as we go through the PowerPoint presentation. Polling question number 2, on a scale of 1 to 4, 4 being high, how would you characterize your board's effectiveness? So those of you that are participating on the board, where would you rate how effective your board is now? So we'll take a few seconds for everybody to participate again. And we'll look at what your results are in a moment here. So the results on your screen shows that 67% of you have rated a 3 on a scale of 1 through 4, 4 being the highest. A 2 at 33%. So I am going to open up the floor really quickly to ask, and if we could pause just for a little bit, and well, you know what, we'll reflect back to I'll pose this question up later on. So thank you for participating. Let's go ahead and move through the PowerPoint. I'm very interested on why folks are rating their effectiveness at a 2 and a 3. So first off, let's define a board assessment. It's really a process of looking at our makeup objectively, at how the board does its work, what it does well, and where we might find some opportunities for improvement. It is a conscious effort, okay, to move from the current level of performance to the next level. Next point. So based on the belief that self-awareness it's really that first step where we begin to are able to understand what our baseline performance is, our thoughts, our biases, our abilities, our capacity, all of those things, right? We have to be self-aware of what that baseline is in order for us to move forward, in order for us to know where our gaps are, where our opportunities are. Also understanding as a board, where are our strengths, and at what point do we don't need to emphasize in one area of our board makeup or our responsibilities or the things that we need to do as a group. So it's really, really important that that self-awareness is critical and an important part of understanding, again, where we're at and where we're aiming to go and where we want to be. So why is it important to conduct a board assessment? Well, there's several reasons. We might want to measure, again, like we asked ourselves at the beginning of this talk, how effective are we as the group of the board of directors? Okay, so identifying, again, what our board strengths and weaknesses are. It's really, again, an opportunity to reflect on what our roles are and responsibilities. Often we hear of stories or some confusion or, you know, of times where we might mesh with operational types of duties and responsibility. So there's that fine line of when we begin to have oversight. What does that really mean? And am I really taking an active role as a board member, but yet not, for example, maybe micromanaging or something of that sort, okay? So, I mean, that's just an example. We also want to foster growth and development of our board members. When we think about board members, right, we might come from different experiences, backgrounds, credentials, disciplines, and so we bring, when we come together, we want to complement each other's. And so, for example, if I want to be a part of a board membership, I want to know, for example, for me to come to the table, I want an opportunity to learn about what another board member might possess and be able to contribute so that I might grow in the capacity as a board member. So there's opportunity for that as well. Identifying different opinions and perceptions of board members. I think this is critical. This is just the human dynamics, right? It happens every day. Reminds me of a point that my grandfather and my grandmother made once. Once you are conceived and you are in your mother's womb, from that point on, someone and everyone, the family, extended relatives, the community will be talking about you. all the way until it's time for you to go home to the holy people. So let's get used to it and be able to identify those opinions and perceptions, and being able to thrive and survive and coexist with those things, and how to be able to navigate through what we call the dance in executive leadership. Okay, next slide, or next point, sorry. Increase our level of engagement. I've done several board of director trainings before, and this is always a major concern is how do we engage? And what does that mean? How do we define that? Everyone on the board of directorship, the membership, has a personality. They have different ways in which they view and define leadership, how they view and how they think they should participate in a leadership capacity. That really, and our values, right? Our belief systems, even how we're taught, how we are raised, and how we congregate with family, community, and all of these things really impacts our level of engagement and how we define that. So that is also an important part of it. So when we assess the board, this is also some areas that we might be also looking into. It reaffirms and or redefines the mission, the vision, and the values. It's really important to revisit some of these things because our executive leadership, right, the CEO and top leadership, the executive directors for each of the divisions and the urban Indian health organizations that we have oversight over as board of directors, those staff will be doing their part in recruiting some of the best in the industries as it relates to healthcare or primary care or behavioral health or outreach and referral agencies, right? They're actually expanding. And so our job is our mission and our vision and our values, are they changing and evolving with the population base that we're serving? So those things might come up in our discussions when we're going through a board assessment. We also increased our credibility within the board. And also it displays to the staff, right, the organization that we represent, to them that we do this as self-assessment as well as a group. And that's an important thing, that buy-in and that mutual support that we can receive from the staff as well. And they see that when we do these board assessments, it's really important. Of course, our funding sources and other key stakeholders, accrediting bodies, right? We might have state, federal, local. We even might have to answer to tribe regulatory agencies and counterparts. And so it's very, very important that when we do and partake in this process of an assessment of our board and our makeup, it gives credibility in all of these different arenas. And then, of course, builds trust, like I said, respect and communication. It also ultimately promotes the team work. Everybody defines that differently, and even discussing what does that mean? What does it look like? What should it feel like from every single representative? And being able to come up with, I know that I'm participating in the highest level of cooperation, commitment, respect, the thought of moving forward together. That's how I feel it when I get this from my team members or from my support from my fellow board members, and we move together. That is how I would define teamwork, for example. So being able to discuss some of these things openly, freely, without judgment is really key and important. But it takes a process. You know, the whole idea around group formation is important. There's a lot of different steps and phases that groups go through. And so these, I just wanted to make sure that we highlighted the importance of board assessments and why we should do it. There are different ways in which we can when we do board assessments, there's different ways we can do that, and these are the components of it. We commonly hear quantitative evaluation or qualitative evaluation. There's different ways we could do. We did a quick quantitative evaluation at the beginning of this talk, rating on a scale of 1 to 4, for example. Qualitative are much more conversations, asking open-ended questions that solicit for ideas, thoughts, recommendations, and things like that. Or experiences. So there's lots of ways to create a board assessment, and it can include these types of evaluation approaches. So the next point is we could use checklists of practices, and they're all over. If you Google anything around board of directors, they'll pop up. But there might be some quick assessment tools out there where they encompass yes and no types of questionnaires. There's also this is really important, and it goes back into the, this could be a qualitative element or part of it, and we're seeking the degree of satisfaction with it. Well, for example, we ask the question, how effective do you think the current board you sit on is? Okay. That is going to be we're measuring what is the degree. And for this particular audience, we rated our participation in that survey between a 2 and a 3. So we're saying right now, the current board members that are participating in this particular training, we felt the effectiveness across the board ranged between a 2 and a 3. Okay. Now if I were a part of that, we were a board of director, I would bring that back to the group and let's talk about that. What is it that's causing us not to be effective? The level of commitment we could look at, or the personal level of satisfaction with the board service. Demographics, this is important. Our board size and composition. Do we have a representation that is reflective of the population that we serve? If you are HRSA, funded, for example, they're going to want to know that as well. So it's, things like that is really important. So these are different components and can be different components. You could have all of it, a combination of it, or one type of component, or ways in which you can evaluate your board of directors as a group. So when should a board of directors assessment occur? When you're considering a reorganization of board, that's a time to recess. Okay. In preparation for a major organizational expansion, again, like for example, HRSA, you might be a federally qualified community health organization. They might want to understand, what is your board makeup? Are you inviting key individuals from the community that can speak? For those who cannot speak in the community, are we recruiting the right individuals to be representative of that particular patient population? So it's really important that when we're going through major organizational expansion, funding, opportunities, this is a time probably to look at the current board assessment and see if there's opportunities in there as a group to come and brainstorm and bring ideas and expand as well and reflect our organization's expansion. It also is done, during the strategic planning process as well. When there might be, we sense like a lack of engagement. Okay, this doesn't feel right. Let's talk about something here, and bringing that up is really important. When we might have high turnover rates and uncertainties about our board responsibilities, right? Sometimes that might be the cause of our high turnover rate, is because we don't understand exactly what our responsibilities are, our roles, and how we can contribute to the team. We might feel left out, or we might be overly worked when we're maybe the main one contributing. Lots of feelings and a lot of things that a board of directors, the core group, has to talk about and evaluate. When there's too much conflict or complaints, I'm sorry, within the board. Like there's just so much going on, trying to unveil what is the core element, what is the core situation, so that we can get to the bottom of things. So you might want to bring in an external party to kind of go through some of these things, and that's what I would recommend. After a financial or executive leadership crisis, there might be some turnovers for the organization, and especially for the especially with finance division or like our CEO. The executive, the C-suite leadership is a really important line of leadership team that is also just as important. So something to look at when we're thinking about when and why we should do a board assessment. So what are some potential results of a board assessment, right? So again, renewed commitment and engagement. We might increase our knowledge and skills of board members as well. The clarity of our roles and responsibilities of the board and the individual board members might, be nice and clear. It's going to be broad sun, daylight. We're going to see everything that we are going to understand, how we mesh and how we don't mesh, where we mesh and where we don't, and what we need to do to work together. Strengthen goals and contributions of the board committees and subcommittees. Clarity of expectations of board service is also going to be in there. Enhance orientation to new board members, right? We want to make sure that all of our ducks are in a row, and that when we recruit potential new members, that we're able to communicate how we operate, how we do things, and how we approach things at a higher, much higher level in regards to supporting that organization which we represent. Identify non-contributing and participating board members. Now, this is a really hard stance statement. You might want to identify ways on how to do this, and there's strategies that you can do this where you can allude to it in the assessment in itself. So there's a time and a place for it. And there's a process to go through it, so that any one individual who may not, for example, if I'm not participating or I'm not contributing, and my fellow board members are feeling that or recognizing that, then creating that internal group, I guess, norms, conduct, or maybe a process of bringing these issues up, so that I'm aware that when I'm being onboarded as a board member, oh, this is what can happen if I'm not contributing and if I'm not participating. If I miss 4 or 5 meetings in a row, there is a consequence, right? So making sure that that's even a part of procedures, your bylaws, is really critical and important. So we all are aware of what the expectations are in the beginning, through the process, and all the way through as we connect on a regular basis. All right, what are some potential obstacles? So there's a few. We might come across where we as board of directors individually, we might resist to change, or as a group, okay? So that could be an obstacle. Change is difficult, and so that's something could get in the way. Inability to be honest with ourselves is really key and important thing. At the beginning, one of the key things I emphasize is doing an evaluation or an assessment that that's not going to include our biases, right? Judgment, or it has to be objective. It's really important. So, and also the ability to be honest with ourselves individually and as a board makeup is really important. Sometimes we just simply don't know, right? There might be just things that we are doing that we're not aware of. We may not have been trained properly, or with this particular board makeup and expectations, that something that you were doing is just not a part of the group's norm. or it wasn't written in the bylaws, for example. And so it's really important that, you know, that might get in the way of being an assessment being a potential obstacle, right? And other things might include our CEO or other C-suite leadership might act as filters, meaning that they kind of stop the process and initiate the process, that sort of thing, when we can write within our own bylaws that this is how we're going to conduct our assessment at this time, with maybe it's on a yearly basis or every 2 years, depending on probably your organizational ability and how fast it grows, or if it's pretty, you know, consistent, or it tends to grow fast, then we might do a yearly basis. Let's look at our board makeup and all the different ways in which we should be functioning. Also, time and money. Sometimes it takes a little bit time to do this. For some board of directors, they might look at outside sources to come in and conduct an assessment. There are online programs, and there's also some tools that a lot of folks can utilize to create their own internal board assessments. And we'll talk a little, we'll provide an example. Today I'm using the BOARDSOURCE.org to show you an example of how a board can do self-assessment. These elements that are reviewed include the people, the culture, the work, and the impact. So these are the 4 domains, so to speak, or in this slide, it's referring to it as categories or elements, okay? So the people, again, what is our board composition? Earlier, I talked a little bit about how HRSA, you might want to go after some HRSA funds. And as a federally qualified healthcare center, we have to make sure that we demonstrate that on our board representation, it's reflective of some of the population we serve. So our composition is going to be important. The board structure, how often our board meetings occur, right? Again, there are different regulatory and accredited body that have oversight over the way we operate. And that might really drive also how often we meet, the structure. Are there committees and subcommittees, that sort of thing. The other is really important, the culture and the dynamics. In a lot of our healthcare systems across the country, a lot of our leadership in healthcare systems have talked about the culture of, you know, the way we operate as a healthcare system, how we lead. A lot has to do with how we define it and how we engage with our healthcare teams and organization, which we represent or work with as a board member. Next slide. And of course, the work, right? This is really important. A big bulk of the assessment will go here. A lot of accrediting bodies and agencies will look at these, and regulatory agencies will also look at these pieces. So if we'll go into this a little bit more in the next slide. So this is key because you know, as an organization's top leadership and governance body, the board has core responsibility, both within and outside of the boardroom, right? It's a 24/7 job. So these are some of the key areas. Now, when I say, and we talk about program oversight, right, and the financial oversight, I'm really just focusing in and reemphasizing how it's important that we understand what we approve, right? So our senior C-suite leadership, for example, maybe the nursing division or the medical director, the community health or public health, or sometimes it's termed as health promotion, disease prevention, or behavioral health, right? So C-suite leadership is responsible for ensuring that they have certified, licensed, credentialed staff to do the work. but then it comes to you all to approve, to say, yes, they will provide care in our facilities. That could be the program oversight at that higher level. Okay, as board of directors, we don't engage in the hiring process, going out in advertising. We might, hey, we have positions, but the day-to-day operational things is in the hands of the organization, the C-suite leadership and their staff. Okay, financial oversights, making sure that financially and by law, we are abiding by regulatory agencies' requirements. Could be state, federal, local, and those types of oversights as well. So at a higher level that we participate in that. So we need to demonstrate that. And so through this assessment, we can take a look at where are we providing these types of oversight? What are we approving? Where are we partaking in this type and level of engagement? The last is funding and public image. It's really important, and I think leadership in general, in any and all capacity, it's a 24-hour job. How we conduct ourselves, everything from what we say, what we do, and it's in the community, and that image is reflective of our organization that we represent. So we have to remind ourselves, for example, I speak for the best interests for the Native people from different reservations, and they come to our urban settings. And I speak when they can't speak. I represent what they, so, just reminders of like that, those things. Those things could be defined by the board of directors. And this is what we want to represent. This is what's meaningful for us and important to us as the board of directors for this respective organization. Okay. And the other is, this is also important, the impact. And this is where that question comes up, are we effective? What impact are we making? And so it could be from the perception of the board, impact on the organizational performance also. So we could look at the different reports that are coming up from the organization, whether it's finance. It could be the top 10 diagnosis, what are we doing as a primary care? How many of our patients are not showing up at the emergency room? So is our primary care creating an impact in the way we operate as a healthcare facility? There's lots of questions that come up, okay? And so, and there's just not just one or a few questions like I've provided as an example. There's various ways to do that. We talked a little bit about maybe using checklists or, just the different ways, both quantitative, qualitative evaluations, open-ended questions, that sort of thing. You might also want to consider the organization itself, the C-suite leadership, and they participate a part of that evaluation. But typically the board itself and the CEO might want to dictate and determine what that might look like. So really being able to look at the impact, how effective are we as a board of directors, is a critical question at the very end. So again, we're using BOARDSOURCE sample as we were showing today, and they use a 5-point rating scale on each of the different 4 elements. Okay, so poor, so this is the definitions or the scoring system that's utilized in this particular example. Next slide. Sample questions to the far left. Number 1, for example, we as a board, we are periodically and agreeing on how the organization should fulfill its mission. We're articulating a vision that is distinct from the mission, defining organizational values, using the organization's mission and values to drive the decisions. Okay, next slide. And then more questions. Ensuring like the annual budget reflects the organization's priorities. Okay, so you're doing a quick check of looking at the budget proposals, and maybe there's supposed to be an expansion or development of the pediatric department or program, but yet we're putting more dollars in another department. And you know, this is where we would have some discretion and being able to kind of, during a board meeting, talk about some of these reports and being able to question and possibly navigate, and looking again at our vision, our mission, our values, and the plan of actions and the strategic plans that might be in place, and trying to create a cohesive work effort where we're able to come back together and realign and move forward. So more questions there for you to look at. Next slide. Another sample question is, this really speaks to effectiveness. So the level of commitment to, so, you know, how this really works is each board member would fill this out. Okay, and then after each question, there's a section where you can actually ask open-ended questions so that folks can be able to go back and clarify and explain how they rated. Okay, so next slide. And this is where these open-ended questions can, these are very broad, they can be changed to fit your need. But we could ask something like, would you like to provide any comments or context, right? So that's a yes or no. We would probably rephrase that to really encourage the participant, the board member, to be able to provide some comments and context to how they rated different sections. The other is, how can the board improve its improvement in this area? And what are 2 or 3 most important areas the board should address to improve performance in the next year or the following year, 2 years? Next slide. This is just a sample report, okay? So basically the domains are in the far left column, and then the different sections or the roles that we participate in as a group, as a board of directors, and then the responsibilities are there, and then the rating, the actual rating, the average score from each of the board members are in that column second from the right. Okay, now I want to explain a little bit about the benchmark. The benchmark is, or goal, something we're aiming for, right? So as an organization, a lot of times across Indian country, we always say we're measuring up against a foreign standard that doesn't fit our population's understanding of how we define health, how we do health, how we treat health, how we think about health, and how we conduct business in the modern world as American Indian, right? So it's really important that as a group, before we actually do an assessment, we decide as board of director, as a core group, how to define what that benchmark is, what is our goal. Okay, so don't be, just because you get an assessment, a tool, a recommendation, it doesn't mean you can't change it. You can actually experiment with it, test it, and run with it. Okay. Zep is on the call, so I'm going to throw in a little bit of quality improvement opportunity, and even in assessment of board of directors, and she can comment more on that. This is just a sample of the mini governance assessment. This is a quick tool that you can use if you don't want a comprehensive type of an assessment. This might be a starting point for you, and then you begin to think, you can toy with it and begin to ask other additional questions that might meet your needs as a board of director. All right, next slide. This is an example of a checklist practice, quick checklist, right? It's going to be yes or no type of questionnaire. Really quick. It's but you know, there's some plus side to this, but there's also some you know, there's definitely going to be opportunity on you as a group might ask, why is that? And just be open that you might want to include the other components or ways to do a board assessment, as we talked about earlier. Next slide. I wanted to share with you quickly also a quick self-evaluation of an individual board member. So this is for you yourself as a one representative on the board, asking yourself these questions. Do I understand and support the mission of the organization? Am I knowledgeable? Do I follow the trends and do I assess? Do I read and understand the organization's financial statements? Do I have a good relationship with the chief executive? Do I recommend individuals for service to the board? You know, so there's this whole slew of questions. So this is also a good tool to have. So not only are you looking at the board as a group, but it's also important to do a self-evaluation as a board member. Okay. This is just a quick tool. The slides will be shared with you so you can take a look at these. There are a reference page for you as well. You're more than welcome to take these materials and make it yours, modify it, and use to your liking. And of course, these are things to consider. We want to enhance board member engagement and accountability. So we again clarify expectation of board service. What is it that we're doing with the position descriptions, attendance, or how do we want to brand our ambassador role? And I believe our communications director is here on the call as well. She might have some ideas around that. So I welcome her thoughts. Also establishing a governance committee by changing the name of a nominating committee or expanding its scope. So again, it really, these are some other key points under that. For example, ensuring leadership development within the board, creating opportunities for that as well. An additional consideration, maximizing value of time spent in board meetings. It's really important to orient ourselves for the future, right? To be present, to be in the moment, but also preparing, consenting to agendas, and knowing what's going to be on the agenda and understanding that. Trying to minimize some of the reporting and focusing on larger type of strategic things that can come across your way. Creating opportunities for deeper, more robust discussions, maybe breakout groups, and then being able to create common themes from those breakout groups, because we can go into breakout groups, right? But we want to come back with common themes, or we want to come back with next steps. We want to come back with actionable items, with, maybe SMART goals. We want to make sure that it's measurable, that there's going to be an outcome, there's going to be a timestamp to it, right? It's accomplishable. All of those things are really important. So, so when we begin to have our side conversations, bringing it back to the core group is really important as well. We want to think, pair, and share. Pre-reads is really important. Again, being able to be actively participating, engage, understanding the content, everything that we have to look at to prepare, to make decisions on, to support, enhance, promote, whatever we need to do as board of directors. This is just a quick list of the resources that I utilized today for today's talk. I am going to open up the floor for comments, your questions, your thoughts, and one of the things I'm very interested, if you guys, we could stop sharing, and if we could just unmute ourselves and put ourselves on camera, it would be awesome. I'm interested in those who rated themselves at a 2, 3. If you could share how you define 2 and 3, and why you gave those ratings at that level, and what, based on what we covered today, if there anything different you'd like to incorporate or do with your board of director group. I'm good with quiet.
People could unmute or just raise their hand, however they want to indicate that they'd like to talk.
It's okay. It's okay. I have a background in nutritionists and as a dietitian and nutritionist. Every time I did a talk about nutrition after lunch, it was never good for me. It feels like that, having a Friday afternoon and the late session of the whole series, that's a challenge. So yeah, well, I do hope everybody was able to digest and hear and see the different components. Sure.
I was curious. I saw one of your considerations was the idea of the brand ambassador role for board members, and I wonder if you could just expand on that for a little bit. What you mean by that brand ambassador role for a board member? How?
When you think about Indian health or urban Indian health organizations, or even in tribal communities, a lot of the times. This is one example. There's lots of ways to look at this, but if you let's talk a little bit about distrust of healthcare systems in Indian country, right? Mm-hmm. So as a board of director, we might want to change our image in our communities and the organizations we represent to start to promote that. What language do we want to utilize? What is the platform that we stand for and support this urban Indian health organization? What is it as me as a board member, for example, if I'm a board member, what kind of language and what platform should I stand on when I engage with maybe community members that I often visit in my urban dwellings, in my cities? How do I promote that? And so that's what I mean by branding. And so it's really important to discuss what that might look like for your organization. So that's a common type of, I guess, theme or element or obstacle sometimes organizations face. Right now, we're trying to convince, vaccination to take place. We're talking about flu vaccines as well. And so there's this conversation, happening in every day, in our world every day, whether it's our family and our communities. But how do we, get the population we serve to trust us? And part of that's going to be our image, what we speak, how we act, and what we promote outward. So to some degree, our board of directors might have some responsibility with that. Not just them, It includes our C-suite leadership. It includes our staff and how we engage. So that's one example of how we talk about branding and how that could really be able to uplift and bring in those things. Yes, Sarah, our experts in the room regarding that particular piece.
Hello. Yes, branding is one of my favorite things in the world because it can show who you are. It can show your integrity, because it's a matter of consistent messaging. So I think whenever someone is representing your UIO, your organization, your board, before you kind of go out into the world and say all the things to whoever you're speaking to, kind of pause and get together and say, okay, what are we doing? What's the game plan? And that is going to be reassuring to your audience, because when they see one representative saying one thing and another representative saying the same thing, they're like, oh, they've got it together. They're trustworthy. So that's just kind of my note on branding. Do it.
Thank you, Sarah. She is our expert at NCUIH when it comes to communications, everything and anything around communications. If you ever need to bounce some ideas, please don't hesitate to reach out. I appreciate everybody's time for being here. I know it's late, it's Friday afternoon. I believe we're gonna pause here. I'm gonna hand it back over to Divya to kind of give some directions as we go into right before we go into the break.
Yes, so thank you so much, Evey. This was a great presentation. We thank you all for being here for the board self-assessment session. Again, we welcome the heart reaction, celebration reactions to thank Evey and appreciate Evey.